Hello everyone, my name is Joshua Zent and I serve as the Deputy Chief of Community Risk Reduction for Northwest Fire District. Today we're going to explore 4 critical learning outcomes from the Executive Chief Officer 3 program that help shape modern fire service leadership. I will be applying a CRR lens to today's presentation to emphasize the important role that it plays for Executive Chief Officers and the communities that they serve. We're going to be exploring the 4 learning outcomes that help shape modern fire service leadership. These outcomes include leading with transparency and decisiveness, applying data-driven strategy to optimize operations, and choosing community development initiatives to enhance well-being, and delineating regional cooperation effectiveness for a unified response. Each of these outcomes addresses a vital dimension of executive leadership in the current era of the fire service. Transparency and decisiveness foster trust and clarity during high-pressure situations, ensuring that personnel understand the rationale behind our decisions. Data-informed strategies empower leaders to move beyond assumptions, leveraging analytics to improve deployment, resource allocation, and performance metrics. Community development initiatives reflect the evolving role of the fire department as proactive partners in public health, housing safety, risk reduction, ultimately reducing that long-term operational strain. And finally, regional cooperation ensures scalability and resilience during large-scale incidents, promoting interoperability and shared resources across jurisdictions. Together, these 4 outcomes form a strategic framework that integrates organizational leadership, operational efficiency, and community engagement with interagency collaboration. This session will explore practical applications, some real-world examples, and actionable strategy for each outcome, equipping attendees with tools to lead effectively in today's dynamic fire service environment. All right, we're going to discuss strategies for transparent and decisive leadership. Transparency and decisiveness form the foundation for credible leadership. In the fire service, where uncertainty and rapid change are constant, people look to executive leaders for clarity and direction. So this means sharing information proactively, explaining the why behind decisions, and making timely choices, even when the situation is imperfect and information is incomplete. Transparency helps prevent rumor-driven resistance, especially during organizational change. This is that rumor control mode that we often find ourselves in when inaccurate information escapes. So whether it's staffing adjustments, deployment model redesign, or new policy, being upfront about constraints and goals builds trust. Decisiveness, on the other hand, gives personnel confidence during a crisis. When leaders step forward with well-reasoned decisions, it stabilizes the organization. Together, transparency and decisiveness support a shared understanding, a unified response. All right, next we're going to discuss optimizing our operations through analytics. Today's fire service leaders can't rely on intuition alone. We must lean into our data. Data-informed strategies allow us to analyze trends, forecast risks, optimize our staffing, and identify gaps in service. Data-informed strategies are essential for optimizing departmental operations and ensuring resource efficiency. Modern fire departments generate a vast amount of data through CAD systems, RMS platforms, community risk assessments. By leveraging this data, it allows leaders to identify trends, predict demand, allocate resources effectively. Examples may include using heat maps to pinpoint high-frequency EMS calls, or enabling targeted mobile integrated health programs, or analyzing turnout times to identify training needs, and reviewing inspection turnaround times to optimize prevention staffing. So implementing these strategies requires building digital dashboards, automated reporting processes, and training officers in data literacy to foster a culture of evidence-based decision-making. Data integration with our external partners, such as health department or maybe law enforcement, it enhances whole community risk analysis and supports collaborative solutions. So by prioritizing our analytics, executive leaders can justify budgets, improve operational performance, anticipate emerging risks, ultimately positioning the organizations for proactive rather than reactive service delivery. But data, it's only as good as the culture surrounding it. Leaders must create an environment where personnel feel empowered to ask questions and use data to inform their decisions. As executive chiefs, we ensure officers receive training on data literacy. Data becomes an everyday tool across the organization, not just an administrative function. All right, next we're going to be discussing enhancing the community well-being through fire service leadership. As executive leaders, our influence extends beyond emergency response. We must help shape the conditions in our communities that determine risk. Community development initiatives strengthen community well-being, which ultimately improves safety outcomes and reduces the operational strain. Community development initiatives reflect the fire service's expanding role in promoting public health and safety beyond emergency response. Executive leaders must engage with our stakeholders to address underlying risk factors, such as residential fires, aging populations, or wildfire exposure. Examples include partnering with community stakeholders to improve home safety. Think about these smoke detector walks or maybe some smart burner technology that are being applied. Or how about collaborating with senior centers to reduce fall-related calls? Or implementing wildland-urban interface mitigation programs that align with local development plans or hazard mitigation plans. Ultimately, these effective strategies involve early engagement and city planners and developers to integrate fire-safe design or adopt new fire code and amendments, leveraging grants and nonprofit partnerships to fund prevention programs, and maybe hosting community outreach events to build trust and gather actionable feedback. These initiatives not only enhance community well-being, but also reduce long-term operational strain by preventing incidents before they occur. These initiatives represent a shift from reactive fire response to proactive risk mitigation. This is a cultural shift in how we do business in the fire service. When we integrate with community development, we position the fire service as proactive partners in health, safety, and resilience. All right, next we're going to discuss promoting interagency collaboration and scalability. So no modern fire department can stand alone. The scale and complexity of today's emergencies, from wildfires to active shooter incidents to extreme weather, require a unified regional response strategy. Regional cooperation is critical for managing large-scale incidents that exceed that capability of a single agency. Unified response framework enhances resource sharing, operational consistency, and political leverage, ensuring communities receive timely and effective emergency services. Examples include automatic aid agreements that eliminate the jurisdictional boundaries, joint training programs that build interagency familiarity, and shared dispatch centers that streamline communication to reduce response times. Strategies for improving regional cooperation include formalizing MOUs, developing IGAs, establishing regional command structures that align with NIMS and ICS principles, pursuing joint grant applications to maximize funding opportunities. Executive chiefs play a crucial role in this process by negotiating those agreements, aligning our policies, and building strong relationships with surrounding agencies. A unified regional response increases efficiency, safety, and public confidence. By prioritizing a regional partnership, fire service organizations can achieve scalability, resilience, and interoperability, positioning themselves to respond more effectively to a complex emergency, such as wildfires or maybe mass casualty events or infrastructure failures. The challenge is finding opportunities to practice and apply interagency collaboration to scale. In addition to the everyday responses that engage the automatic aid partners, we have applied this principle to reoccurring large-scale public events. This allows integration of fire, law enforcement, public works, community groups, and other governmental agencies to interact several times a year. This builds relationships, so when a large-scale incident does occur, you already have familiar faces and agencies working together with a better common understanding of each other. So now we're going to look at applying all four of the learning outcomes in practice. When we bring these four outcomes together, we create a powerful leadership framework. Transparent and decisive leadership builds trust. Data-driven strategies improve operations. Community development initiatives address the root cause of risk. And regional cooperation ensures that we respond effectively when incidents occur. These outcomes are interconnected. For example, implementing a new EMS deployment model requires transparent communication, data analysis, community engagement, and regional alignment. When all four are applied, organizational change becomes smoother, faster, and more effective. So let's walk through a brief example. Our district implemented an EMS risk-based deployment model change recently. We added BLS transport to our current ALS system. Simply, we are now transporting all patients regardless of severity. So how we tackled this problem is first, we started with transparency. We communicated early and often about why this change is occurring and what problem it solves and how it benefits the workforce and the community. Getting accurate information out to the crews, the reason behind the change, it keeps everyone centered on the goal and it gives everyone a common understanding. Second, we relied on data. Incident density, peak demand hours, unit hour utilization, all kind of guided this new model. This information provided initial forecasting of what could be expected by the crews, what impacts they would see by adding BLS transport volume to their workload. But remember, this data needs revisited often to ensure what was expected is actually occurring. Room for flexibility in the model is crucial. The data is a tool to predict changes and how the organization may need to adjust in its decision making to ensure the change remains fluid and keeps the necessary buy-in by those who carry the workload. Third, we engaged the community and built more community development. We met with hospital leadership, high volume facilities, clinics, all to understand their needs, explain the change to our system, and discuss prevention strategies to reduce impact system-wide. The stakeholders need an understanding of the change, so they can also adjust to ensure the community resources and availability remain solvent. Finally, we coordinated regionally, worked with regional partners, automatic aid agencies, mutual aid agencies, or EMS transport agencies, and dispatch to align practices. In our system, we're limited in the number of available ambulances at any given time. along with our regional partners. So keeping current on the status of each agency and their needs allows for flexibility across the system when surges occur. This type of integrated leadership produced measurable outcomes, improved response reliability, fewer preventable incidents, and more effective resource allocation. So a few key takeaways and questions for engagement. As we come to a close, I'd like to offer a few questions to engage your ideas. Which of these four leadership outcomes represents the greatest opportunity for improvement within your department? Where do you see gaps in your data? How could better analytics inform decision making? What regional partnerships could be strengthened to improve a unified response? And finally, what community development initiatives could reduce long-term risk? These questions help guide strategic conversations that executive leaders should revisit regularly. In closing, executive chief officers are more than administrators. We are architects of systems that protect and strengthen our community. By leading transparently and decisively, using data intelligently, engaging in community development, and promoting regional cooperation, we shape a safer, healthier, more resilient community. From a CRR standpoint, it's very simple. Fewer emergencies, safer community, safer firefighters. Thanks for your time, and I'd be happy to discuss any of these ideas further. I hope you enjoyed it.